clinical work that I'm a part of at UT Southwestern is with what's called our functional neurological disorder multidisciplinary clinic. And functional neurological disorders, or FND for short, are a quintessential neuropsychiatric condition that exists within neurology and psychiatry. It is the presence of neurological symptoms and signs that is due to dysfunction in neural networks rather than a focal anatomical lesion. To use the metaphor of the brain as a computer, it's an imperfect metaphor, but can be helpful. We wouldn't call this a hardware challenge, but more of a software challenge. That something has happened to the ways in which the brain sends signals to the body and receives signals from the body and processes those signals. So a condition of network dysfunction. And while it is more complex than just predictive processing and prediction error, predictive processing is very much at the core of what leads to functional neurological disorder. That the brain is making a prediction about the body that is potentially based on prior learning and expectation that isn't getting updated with new sensory inputs. And when it gets stuck in that program, or sometimes what we call in neuroscience that schema, when it gets stuck in that and it doesn't kind of update the software, the brain is making inaccurate and imprecise predictions, and it can lead to a tremor. It can lead to a seizure that isn't epileptic, but can include dissociation, like epileptic seizures. It can include convulsions, but again, not due to epilepsy. It can lead to paralysis. It can lead to gait changes. Basically, anything that can be a neurological symptom could be related to FND, a totally different process. Mechanistically, though, it's a different process than what Parkinson's would cause, or epilepsy would cause, or multiple sclerosis or strokes. And the ways in which we leverage predictive processing in the brain not only helps us explain the condition to patients, but it allows us to treat the underlying cause of the condition. We do that in part through psychotherapy. I often say that psychotherapy is a powerful medication that just so happens to not come in a bottle. Psychotherapy is a lot about re-scripting narrative and re-scripting it in a way that allows someone to feel a sense of agency and control.